I am Dr. Sagar Kulkarni. I am a practicing pediatrician since last 14 years at Aurangabad, Maharashtra. Today, I will be speaking on vaccination general principles which we all must know before we start vaccinating children. Point number 1. Multiple n number of antigens can be safely given on the same date of vaccination. So, you can give 2 antigens, 4 antigens, 6 antigens and so on. There will be no side effect as such, or there will be no such significant interference in efficacy or immunogenicity of vaccine. But it should be given within 24 hours if simultaneous administration is not possible. Vaccination at birth means as early as possible within 24 to 72 hours. But it should not be postponed later than 1 week after birth in any circumstances. For example, let us say the birth dose of hepatitis B. Now, birth dose of hepatitis B is supposed to end the perinatal transmission of hepatitis B. So, it has to be given within 72 hours. There will be no point in postponing such vaccination. Point number 4, the recommended age in weeks, months and years means completed weeks, months and year. For example, if we say that hepatitis A vaccine has to be given after 1 year age, that means completed 1 year age. When we speak that measles vaccine has to be given at 9 months of age, that will mean that 9 months has to be completed. So, in that format we will always speak it. Any dose which is not admitted at a recommended age should be given at subsequent visit as early as possible, but when indicated and feasible. Do not restart the whole series. For example, let us say the third pentavalent dose of a child is remaining for the age of 6 months. You should not restart the series, just give the third dose and that will finish the series. But as I said, it should be when indicated and feasible. For example, if the child has been left out of rotavirus vaccination and if the child comes at 6 months, but we cannot administer the child the first dose because it is not indicated and feasible, because the first dose of rotavirus vaccine is never given beyond 14 weeks 6 days. Point number 6, a gap of minimum 4 weeks is must between live vaccines if not given on the same day, whether same or whether different live vaccine. For example, if we are giving a varicella vaccine, then there has to be a minimum gap of 4 weeks, or if we are giving MMR vaccine, then there has to be a minimum gap of 4 weeks. The same will be applied if we give varicella and MMR, which are two different antigens. A minimum gap of 4 weeks is essential between these two vaccines if not given on the same day. But this principle does not apply to live vaccines given at mucosal surfaces. For example, polio or rotavirus. You can give these vaccines at any interval, today, after 7 days, after 15 days, after 4 weeks and anyhow. But there is exception to this exception. Live nasal influenza vaccine should be given at a gap of 4 weeks with any other live vaccine. Point number 7. Minimum interval of 4 weeks is must for inactivated killed vaccines same antigen. For example, if you have given a pentavalent dose or a DPT dose today, and if you want to give the same antigen, then a minimum gap of 4 weeks is must. The exception is of course rabies because the schedule is different. No minimum interval if inactivated vaccines of different antigens are given. Example, if I give a penta today and if I want to give a pneumococcal vaccine, then I can give it at any interval. No minimum interval between killed and live vaccine is needed. I can give a MMR today and I can give a pneumococcal vaccine 15 days after or 7 days after. So, no minimum interval is compulsory between a killed vaccine and a live vaccine. Minimum acceptable age should be followed. If given before that, then the dose is considered invalid. Then you will have to repeat the dose. For example, let us say the minimum acceptable age of hepatitis A is 1 year, and if you give the vaccine at 10 months, then it will be considered as invalid and you will have to repeat that dose at the recommended age. Minimum acceptable age and recommended age are two different things. For example, let us say in the case of varicella, the recommended age is 15 months, but the minimum acceptable age is 1 year. But that does not mean that we start vaccinating every child of varicella at 1 year of age, because the recommended age is 15 months only. One more principle which you should know, that inactivated vaccines can be given up to 4 days before minimum interval of 4 weeks. Now, this is called as the 4-day grace period. So, suppose a patient comes to you at 26th day and she is not able to come later on, then you might give the dose fearing that you may lose the patient. This is called as the 4-day grace period. But remember, this 4-day grace period does not apply to live vaccine. In live vaccine, anyhow, a minimum gap of 4 weeks is compulsory. Few general principles for administration of vaccine. Change of needles for drawing injection and for administering is not necessary. Aspiration before injecting vaccine is also not recommended. Now, this is a tip that though some recommend that you should aspirate before vaccinating, and if blood is drawn inadvertently, there is just a need to change the needle and give it at a separate side rather than throwing the vaccine away. but the general recommendation is there is no need of aspiration before giving the vaccines. Different vaccines, they should not be mixed unless and until the product is licensed for the same. After opening the vial cover, rubber cork should be cleaned with alcohol swab. It should be allowed to dry, and then only vaccine should be administered. After cleaning with spirit or alcohol swab, the injection site should be allowed to dry, and then only the vaccine should be given. Otherwise, there is a risk of inactivation of our live vaccine because of spirit or alcohol. Also remember that after removing the needle, gentle pressure is to be given on the site of administration with the help of a dry sterile swab and not a spirit or alcohol swab. Also, patient should be observed for around 20 minutes after vaccination. This is to ensure that the patient does not land up into any anaphylaxis. When different vaccines are needed to be given on the same day, can we use it? Yes, we can give different vaccines on the same day, but will have to keep a gap of 1 inch between 2 injections, and generally the site chosen is anterolateral thigh because there is a large muscle mass there. Next point, less quantity dose or non-recommended route used should be considered invalid and should be repeated. Suppose we have an adult patient, and if you give a 0.25 ml flu vaccine to him, then it will be considered as invalid and you will have to repeat the dose. While administering, don't use same syringe for different vaccination even in the same patient. Different syringes should be used for different vaccination even if the patient is same. Always and always prefer auto lock or auto disable syringes for vaccination. Disposable syringes can be used, but preferably they should use only for reconstitution of vaccine rather than administration of vaccine. Diluents, use diluents supplied only and only which are being supplied by the manufacturer. Do not substitute. For example, if the diluent of MMR is not available, you are not supposed to use distilled water as a substitute, or if the diluent of BCG is not available, you are not supposed to use normal saline as a substitute. Always check for expiry date on vaccine. If expired vaccine was given inadvertently, then it should be repeated. It should be considered as invalid. What exactly is the expiry date? It is printed on the vaccine. If only a month is written, then vaccine can be used till last date of the month mentioned as expiry on that vial or ampule. If the date is mentioned, then well and fine. Next point, routine testing of seroconversion after vaccination is not recommended. It is recommended only in special situations like, let us say, stem cell transplantation or in immunocompressed patients. Routine immunity testing before giving vaccines is also not recommended. That is also done only in some exceptions, like in dialysis patient, or for example after transplantation. If more than full dose of vaccine is given, no harm is there. For example, if a pediatric patient of 2 years is given 0.5 ml of flu vaccine, then that will be considered as valid. Of course, we don't use adult doses in pediatric population, but at least there will be no harm. That dose will be considered as valid. Next point, mild illnesses or mild fever, mild respiratory tract infection, mild gastroenteritis or any other mild illness is not a contraindication for giving vaccine. Only if the child is having some severe acute illness, then that should be considered as a contraindication, but later we don't know whether the complication arisen was because of the illness itself or because of a side effect of that vaccine. There is no harm in giving vaccine if the patient has a history of the disease, because most of the time it is doubtful in most cases. For example, if a patient gives a history that he already has measles vaccine, then we don't believe it that way, we give vaccine to these patients also. There is no harm if vaccine is given if history of vaccination is in doubt, especially this occurs when documentation is lost, because even if we give a repeat dose of that vaccine, then that will be beneficial and will not cause any harm to that patient. Next point, convalescent phase of an illness except measles is not a contraindication to vaccination. Example, if some child has recovered from typhoid, then that is not a contraindication for giving the next scheduled vaccine. Next point, breastfeeding in no way interferes with vaccination. You can give vaccination before or after breastfeeding. Only fainting episode during previous vaccination is not significant. That you have to remember, because it is not anaphylaxis. You should know how to differentiate anaphylaxis with a vasovagal attack. Vaccine adverse effects in family members is not a contraindication for giving vaccine. It is another point to be noted. Malnutrition, is it a contraindication for giving vaccine? No, malnutrition is not a contraindication. Positive Montaux test without evidence of active TB is also not a contraindication to vaccination. You can do simultaneous Montaux test along with any vaccination. Antibiotic therapy, antiviral therapy, these are also not contraindications for vaccination, but there is an exception like nasal influenza vaccine and oseltamivir. You cannot give these two together, because otherwise the vaccine will get inactivated. Another example is acyclovir and varicella. This cannot be given together. Combination vaccines are always preferred over single antigens because they reduce the number of visits of the patient, they reduce the number of painful pricks to the child, and it increases the compliance and the timeliness of the vaccination schedule. But remember, don't convert single dose vials into multi-dose vials in office practice, because it is not allowed so. Remember, interchangeability of brand of same antigenic makeup and interchangeability of brand of different antigenic makeup are different issues. PCV10 and PCV13, these are not interchangeable. There are different reasons. Mostly the studies are not available, and second, the boosting effect which is achieved is always suboptimal if you interchange the brand. But remember the general statement. If the earlier brand is not known, or if the earlier brand used was not available, then you should continue the vaccination with other brand rather than rejecting the patient. That you have to remember. What is a contraindication? Contraindication is a condition that increases the likelihood of a serious adverse event. In simple words, it is no to that particular vaccine. Example, anaphylaxis to previous dose is a contraindication. But then what is a precaution? Precaution is a condition that might increase the risk of a serious adverse event, or even compromise the immunogenicity of the vaccine, or be mistaken for a vaccine reaction. So in simple words, precaution is that you give vaccine but with caution. Last point, what is the difference between a vaccine efficacy and vaccine effectiveness? Vaccine efficacy is the percentage reduction of a disease in a vaccinated group of people compared to an unvaccinated group. Now, this is the ability of the vaccine to protect an individual under ideal conditions, for example, in a clinical trial. But then what is the difference between an efficacy and effectiveness? Effectiveness is the degree of disease reduction due to vaccine program. Vaccine effectiveness is a combination of vaccine efficacy, coverage, and herd effect. Remember, vaccine effectiveness in a population could be higher due to significant herd effect, or lower due to improper cold chain, faulty techniques, or poor coverage. So you should all remember these general points, and then you can safely start vaccinating your children. Thank you.